And we are right in the middle of the big conversation, and we are talking about our ears and how to take better care of our ears. You know, they may look like small organs in your body, but their functions are significant. Not only do ears enable you to hear, but they also provide your body with balance. The ear is one of the most overlooked organs in the body, yet any malfunction of the ear can cause distress, loss of hearing, and excruciating pain, as I found out a fortnight ago. So how do we clean our ears? Are you always popping one item, you know, from cotton buds, matchsticks, and yes, even toothpicks, and even pen caps here in your ears whenever that itchy sensation strikes? You may be getting pleasant relief whenever you do that, but you may have no idea the dangers you are exposing your ears to. So this morning on the big conversation, we're talking about taking better care of our ears, common ear infections, and how they can be treated. I'm also sharing my experience with you, and I would also like to hear from you your experience with ear issues, if you've had those, or you're concerned about something in your ear and you would like to bring it to the attention of our ENT specialist. Please do that on Facebook, KBC English Service, on Twitter at KBC English. We are speaking with Dr. Shailendra Inamdar, consultant ENT surgeon at the MP Shah Hospital. I realized that I was having trouble hearing with my right ear. What do you think I triggered or I touched in the ear that caused that?
Two conditions. One is keratosis obturans, and second is cholesteatoma of the external auditory canal. Okay, you got the keratosis obturans, which is a disorder of the keratin formation in the ear. Normally, what happens that whatever the air cells or the skin flakes are there at the inner end of the external auditory canal, they migrate to the outer ear. Okay, because of our chewing movements naturally. In some people, the keratin does not move normally. It tends to start heap up in the deeper part. It forms a keratin plug. Bacteria start infecting it, and that all the tissue material starts eroding the surrounding skin. When it erodes the skin, or when it reaches the periosteum, which is the covering of the bone of the deeper part of the canal, it gives rise to quite an intense pain. That's first thing. So treatment is usually cleaning under the microscope and applying antibiotic ointment or the antiseptic ointments. Secondly, the people who are having cholesteatoma of the external auditory canal, they tend to have osteitis. Focal osteitis is inflammation of the bone, erosion of the bone, and sometimes causing the expansion of the external auditory canal. That's a surgical condition.
Exactly. The day I scratched my ear was on a Tuesday.
Okay.
There was no pain. Okay. The next day, Wednesday, there was no pain, but I noticed that I was straining to hear from the right side.
Okay.
But by Thursday morning, I started feeling, you know, the pain was, you know, it was not consistent.
Okay.
But on Friday, when I finally came to hospital, there was nothing but pure, utter pain. So when you said that, you know, it came about from my scratching, does it usually take that, you know, from other patients, does it take that time before the pain sets in? So it's just, you're not hearing, but there's no pain.
Evolve very rapidly, say in around 6 hours. Sometimes it takes up to days, 2 weeks to develop. In your case, you might have disturbs that keratin layer, which has allowed the bacteria to gain entry into deeper tissues and then evolving into a full-fledged infection causing extreme pain.
You know, we try everything. We say, you know, it's gonna go by itself.
People really try to use the earbuds for cleaning the ear themselves. Then they go to the pharmacy shop, use some kind of ear drops, and as a last resort they go to the doctor. But I think, considering the delicate nature of and the important functions of the ear, people should be going to the ENT doctors as the first resort, at least for the checkup or proper cleaning, instead of trying all the medicines themselves.
Now, Dr. we've been talking about the condition I came to hospital with and what I'm currently on treatment for. But what was your diagnosis immediately you checked my ear?
Keratosis obturans. Keratosis is keratin, and obturans is obstructive in nature. So that was in the deep part of your ear canal.
So what exactly was causing me the pain? Because it was massive pain. I remember at one point, the painkillers you prescribed for me, I was supposed to take 2, you know, one in the morning, one in the evening. Yes. I remember on Sunday, I came to hospital on Friday. The Sunday after that, I took close to 6 other painkillers in the middle because I could not wait for the evening dosage because the pain was too much.
As I have told, the ear is supplied by 4 sensory nerves. In your case, the disease has eroded the skin, it has gone to the bone. So when something reaches the bone or the periosteum, that gives rise to intense pain.
I'm using the word had because it's past tense. I have since seen the light. I had my Damascus moment already. I had the tendency of inserting objects in my ears to itch. So what should I do when I get that itchy sensation?
Putting anything in the ear. They say anything smaller than our elbow should not be put in there. In short, it means we should not be putting anything in the ear. I can compare with our cleaning of eyes. We don't put anything in the eyes for cleaning. At the time of bath, we just clean with a simple cotton cloth. The same thing applies to the ear. For a normal person, we should not be putting any water at the time of bath. We should not be using any earbuds. If we want to clean, just use a simple cotton cloth to wipe out the outer part of the ear, not to clean anything in the ear.
You know, swimming, most of us don't even have those earbuds. We just jump in and out of water. And you said that we should avoid water in our ears as much as possible.
Swimmers, they should, if since it is their profession, they should absolutely take care of the ear using good quality earplugs and the swimming caps.
Symptom of an underlying issue, right?
Yes, yes.
What issues could be presented by ear infection?
I will start with the pediatric age group. In pediatric age group, adenoids or the enlarged nasopharyngeal tonsil
Pediatric age group is
yeah,
babies.
yeah, babies, yeah, less than 60, I will say.
Okay.
Adenoids, the enlarged nasopharyngeal tonsils, they can cause obstruction in the eustachian tube, leading to recurrent otitis media, infection of the middle ear. Okay, so recurrent otitis media in a child can be a symptom of the adenoids. Okay, in the persons who are having issues with their immunity, like diabetes, or patients who are immunocompromised, like HIV positive individuals, they can also be suffering from the infection of the outer canal or the middle ear.
Now, we are eager to know what is the correct way of cleaning our ears, and should we be cleaning our ears ourselves to begin with?
Very important question. Ear does not require cleaning, so we should not be putting anything in the ear to clean it. Earbuds, anything, cotton. Okay, the simple way of cleaning, at the time of bath, we use a simple soft cotton towel to clean the outer part of the ear, whatever skin or whatever the small amount of wax is there. Anything inside, one should not do it. It's just going to help increasing the bacterial infection or the fungal infection.
What else can we do to be able to take good care of our ears?
When we are using the earphones or when we are listening to the music, we should be keeping the volume to the lowest possible. One should not be listening it for long, especially at high volumes. Secondly, any medicines, especially I am talking about the expectant mother, any medicine they are using, they should always ask the doctor whether it is going to affect the fetus, like gentamicin or the other medicines which can affect the hearing of the baby in the womb.